Hello class, this is Miss Boone. I'm going to be doing a sample head-to-toe assessment for you guys based specifically off of the rubric so you know exactly what to expect and know what your head-to-toe assessment should look like. I have my lovely volunteer here, Mr. Boone, who's going to be our guinea pig for the day. So I'm going to start with the top of the rubric, the dress code. Make sure you guys are in dress code for your check-off. The next thing on the rubric is entering the patient's room. When you are entering the patient's room, you want to make sure that you are, number one, introducing yourself, your role, what you're going to be doing. Number two, explaining to the patient the process. Be like, hi, I'm about to do a physical assessment on you. Number three, gaining the patient's consent, so making them feel like they have agency, asking for permission before you touch them. Number four, maintaining patient dignity in everything you do, so making sure they feel private, so closing the door, closing the curtain, making sure you're not pulling up their gown and just leaving them exposed, things like that. And number five, making sure you're washing your hands and wearing gloves. So I'm gonna go ahead and demonstrate that really quick. Knock, knock. Hello, Mr. Boone. My name is Miss Boone. I'm gonna be your nurse for today. I'm gonna go ahead and perform a physical assessment on you just to check your systems out and make sure everything's healthy, all the way from head to toe, looking at your neurosystem, respiratory system, cardiovascular system, all those different various things. Just make sure you're healthy and everything's good. Does that sound like something you'd be willing to participate in? Is that okay?
Sounds like a plan.
Perfect. So then I would wash my hands in the sink and then put on gloves anytime you're going to be touching the patient, especially if you're going to be touching their mucous membranes or any wounds or any lesions. So that's the first part of the rubric. The next section in the rubric is HENET, or head, ears, eyes, neck, and throat. So the first category is head. So what you'll do is you're going to check their hair, you're going to check their facial symmetry, asking them to smile. So I'm going to be looking at the hair on his head, checking for dandruff, any lice, any lesions that would be in his hair there. So I'm not seeing anything. Hair is well groomed. Good job, you took a shower today. Hair is well groomed. I'm not noticing any patchiness, like no balding spots. Everything is equal throughout. Same thing with the facial hair. Next, I would be looking at facial symmetry. And so really, go ahead and look this way. You're just checking to make sure the eyes are at the same level. You know, when you smile, go ahead and smile. That he doesn't have any facial droop. So if he had a facial droop, he would be smiling on one side and it'd be droopy on the other. That would be kind of indicative of either a cranial nerve dysfunction or a stroke. So his face is symmetrical. I'm going to look at his ears next. And with the ears, you're checking the outer ears for lesions and symmetry and hearing. So looking at the outer ears, making sure to feel them, not feeling any lumps or any lesions like that on this side, and not on this side either. And then for symmetry, you're checking to make sure that they're both like at the same level. One's not higher than the other one like that, so they're both symmetrical. And then you're going to check hearing, so you can whisper something in one of their ears as you're plugging the other ear and ask them to repeat it. So I'm going to block this ear and whisper apple.
Apple.
Apple. Okay, so you close this one.
Strawberry.
Perfect. So both of the ears work well. Next thing you would be doing is checking the eyes. You're going to look for the cardinal movements, which is when you have them follow your finger, looking up, looking down, looking up this way, looking down this way, side to side. You can also check their peripherals and ask them like when they're not able to see your fingers anymore. So I'm gonna start here and you let me know when you can't see my fingers on the side anymore. No. Okay, so that's his peripheral range. Another thing you're looking for as you're doing the cardinal movements is you're checking for nystagmus. Sometimes patients, when their eyes go towards the end of their peripheral vision, they'll start to shake, and that's nystagmus. You would make note of that. You do not have any nystagmus. The next thing is the neck. You're going to check for lymph nodes, and you're going to check the thyroid and for JVD, or jugular vein distension. So the first thing is the lymph nodes. Most of the lymph nodes are located either in front of the ear, we call pre-auricular. Turn your head this way, so like right in here. And then post-auricular would be back here. You don't need to know the names of all of these. I'm just telling you for your own education. They're also along underneath the chin here, so submandibular, and then on the neck here. So you're going to just kind of be feeling and kind of doing circular motions, checking behind the ear, in front of the ear, under the chin, and on the side of the neck. And what a swollen lymph node would feel like, a kind of like a squishy bean-shaped node, kind of about this size, that you would feel. I'm not feeling any swollen lymph nodes here, so that's good. Next, you would be checking for thyroid, and the thyroid is located right here, and so you would be feeling, careful not to occlude the carotids as you're palpating, because we don't want to have lack of blood flow to the brain, have them pass out. So you're going to be feeling the thyroid, asking them to swallow, and it's kind of, you would just feel if you could feel any nodules or any bumps or things that shouldn't be there. Everything's smooth, don't feel any bumps on you. And then you look for jugular vein distension. So as they turn their head, the jugular veins are on this side. On the other side, you would see like a thick rope-like vein to show that the vein is distended, but I'm not seeing that on this side or on this side, so very good. The last section is the throat. You're going to be looking in their mouth, looking at their tongue, their swallow, and their teeth. So this would be a great opportunity to bring out your pen lights. You can check their throat better. So I'm going to ask you to open your mouth. And what I'm looking for is the mucous membranes. I see that they're pink, they're moist. You can close it. If they were more pale, that might be a sign of blood loss. You know, they have lack of blood flow there, anemia. If it's dry, that could be dehydration. But it's moist, it's pink. You're gonna look for any wounds, any lesions in the mouth. I didn't see any lesions in his mouth. You're gonna be checking the tongue, so go ahead and open your mouth again. Same thing, lift your tongue, look underneath the tongue. Same thing, I don't see any lesions. And then you can ask them to move their tongue side to side to make sure that they're able to have full tongue movement. Perfect. And then lastly, you're gonna look at their swallow and their teeth. So as you look, open your mouth one more time, you should be able to see the uvula. Can you put your tongue flat so I can see the uvula? The little hangy ball in the back of the throat. And as they swallow, it should raise up. So go ahead and swallow. I know you guys can't see.
How do you swallow with your mouth open?
You can't. You just want to make sure it raises as they swallow. And then last thing you're going to look at is their teeth. Go ahead and smile. You're checking to see if they have all of their teeth, for one. Congratulations, you have all of your teeth. To see if maybe there's any loose ones or ones that are falling out or wiggly, or if there's any damage to any teeth, any broken teeth or anything like that. So all his teeth are white. They'll each have their partner. They're great. So that is the HENET section. The next system on the rubric is the neurological system. So the three things you're going to be checking is their level of consciousness, looking at their extremities, and checking their eyes. So with level of consciousness, you're going to be assessing their alertness and orientation. So the questions you're going to be asking them are going to be to test if they are oriented to person, place, situation, and time, and then you're going to be assessing their behavior and their speech throughout. So the questions you're going to ask them is like, to ask if they're oriented to person, be like, can you state your first and last name?
Skylar Boone.
And can you give your date of birth?
October 30th, 85.
You can assess this as you're, in the very beginning, verifying the patient identifiers. That knocks out if they're alert and oriented to person. Oriented to place, can you tell us where you are right now?
I am at home.
You are at home, good. And then I'm gonna ask them the situation. So if there's a patient, who's been brought into the hospital because they had a car accident, you could ask, do you know why you're in the hospital today? Do you know why you are here right now?
I'm here for a head-to-toe assessment.
Perfect. And then the last one is time. So can you tell me what day it is or what time it is? Sometimes, they might get the time wrong because they don't always have access to a clock, but they should have an idea if it's morning or night or like what day of the week.
It is Tuesday, September 13th at approximately 4:15 in the afternoon.
That was very specific. Thank you. So any one of those questions you're asking just to make sure they know. Sometimes people ask for situation like, do you know who the president is? I try to avoid that one just because sometimes it can lead down a political rant path that is hard to escape sometimes. So pretty much any question to assess if they know the situation would be appropriate. The next thing I'm going to be looking at under level of consciousness is their behavior and their speech. So behavior is just kind of something you're assessing throughout the entire assessment. It's something that you're constantly looking out for. Is like, are they cooperative, are they calm, or are they belligerent and aggressive and withdrawn? So he's calm, he's cooperative, he's friendly, not aggressive in any way. So I would write calm and cooperative. And then speech, as you're asking them questions and as you talk with the patient, you're assessing like, okay, is their speech clear? Is it garbled? Is it slurred? Patients with stroke will often have garbled speech, or if patient is drunk, they might have slurred speech. So his speech is clear, easy to understand. The next thing I'm going to do is assess the extremities. What I'm going to be looking for here is assessing hand grips, leg and arm raises against resistance, foot pushes, and sensation. So with the hands, I'm going to put my fingers like this and ask him to squeeze of my fingers both at the same time. Squeeze. And I should be assessing whether or not both hands are relatively equal. I know sometimes people are stronger in one hand or the other, but it shouldn't be massively different. A lot of times stroke patients will lose sensation or strength in one side of their body, so they're only able to squeeze with one hand. He was able to squeeze equally on both sides. And then what you would do next is arm and leg raises against resistance. So go ahead and put your arms straight out like this, palms down. I'm going to put resistance against your arms, and I want you to try and raise them. Perfect. And it's easier to do when they're laying down in bed. Just try and lift off the bed, but he's sitting right now. The next one would be leg raises. Could you scoot your chair back? So just I'm going to put resistance against this leg, and you try to raise it. Good. And resistance against this leg. Good. And again, they're both easier to do while they're laying down. And the last one for that one is foot pushes. So I know you can't see his feet. Maybe you can scoot back a little bit more. Still can't see his feet. Okay, maybe just lift your foot up for me. As they're laying in bed, he'd be laying down flat. You would put your hand here and ask them to press their foot down like they're pressing a brake against resistance. So good, he can. And then you would go the other way, have his foot facing this way, and see if he can dorsiflex this way against resistance. And he can. So good. You would check both feet. Everything you're checking is going to be done bilaterally, comparing one side to the other. You can go ahead and scoot back. And then for sensation, this is super important, especially if the patient is diabetic. They often don't have a lot of feeling or sensation in their feet, which leads to having like the foot wounds and the ulcers, which can lead to amputations. So you would have to take off their socks and shoes, if you don't mind doing that, just one foot. You would be checking both feet. Just gonna have them do one for now. And what I often like to do is just have the patient take off both of their socks and shoes and then close their eyes, and then I will lightly stroke the bottom of their foot and ask them, to tell me which foot I'm touching and to tell them if it was right or left, so they can't see which one it is. And then practice, tapping different, parts of the foot to make sure they have sensation all over, because they might not have sensation on the bottom, but they might have sensation on the top. So just checking with light strokes, or you can get like a pen and use the edge of a pen for like a more pinpoint sensation test. Then you can put your foot down. And then lastly, for the neurological is the eyes. So with eyes, you're going to be checking for perla, and that stands for the pupils are equal, round, and reactive to light and accommodation. So this is when you get your pen light out. My pen light battery died, so I'm just going to be using this for show. So what you would do is you're checking first, before you use your pen light, you're just going to look at the pupils and make sure that they are round. The pupils shouldn't be awkward shaped or bulging in any way. They both should be equally round. If they're not, there's some kind of neuro issue going on, possibly a tumor. So I'm looking at both of his pupils. They're both round. They're equal, meaning that this pupil isn't super dilated and this one's super constricted. They're both the same, right? If they're unequal, that's indicative in a neuro problem. So they're both round. They're both equal. Now you want to check for if they're reactive to light. All right, so you get out your pen light, and this isn't working, but we'll just pretend it is. And I'm going to block, I'm going to go like this so that the light can't shine in this eye. The light is only confined to this eye. So I'm going to shine the light in his, what side is this? Your left eye, and this eye should constrict the pupil. Now, this eye should also constrict even though the light is not being shined in this eye. They both should do the same thing. So if one is constricting, the other one should. So that's the accommodation, right? So they're both constricting and reactive to light. If you're shining the light in their pupil and nothing's happening, then they're not responsive to light. And then lastly is the pupil size. I think most of your pen lights have sample pupil sizes on the edge of the pen light with different size circles with 1 milliliter, 2 millimeters, all the way up to 5 millimeters of size. You can hold it up and compare it to their pupil. Open your eyes. So I'd be like, okay, his pupil size matches about this one, so it's about 3 millimeters, okay, and just being able to document about what size it is. So that's the neurological. The next system on the rubric is the musculoskeletal system, which is going to be assessing posture, gait, and range of motion. So under posture, what you're looking at is whether they are slouched or upright. So I'm looking at his posture. He's leaning back against the chair, but he's sitting up. He is not slouched. Can you demonstrate what slouched would look like? Yeah, so that would be, humped shoulders, kind of lack of musculature to hold himself up, but he's holding himself up good. He is upright and erect. Next is the gait. So you would ask them to stand up. I'm gonna move your chair for a minute. And go ahead and start from back there. And we're just gonna ask him to walk normally, forwards and back. And turn around and walk the other way. And you can see that he is steady. He's not wobbling. He's not off balance. It's smooth, it's even, it's not jerky, smooth motions, so he's not a fall risk. Assessing fall risk is very important in the hospital, and you can kind of assess a patient's gait kind of throughout the day as you're seeing them walk and move around. Next, you're going to assess their balance. So you can have them kind of put their feet together and put your arms out and close your eyes, and you can start to see if they wobble a lot or if they maintain relatively the same. So he's pretty good. He's staying pretty stable. Sometimes patients will start wobbling a lot back and forth like this when they close their eyes because they don't have that visual stimulus to let them know where they are in space. But he seems to have really good balance. You can even have some patients maybe balance on one foot and see how that goes. Next is assistive devices. So if patients aren't able to walk on their own or they need a walker or crutches, you would just make a note of that. He does not need any assistive devices. He does not need a wheelchair or crutches, so he is good. Next is range of motion. So go ahead and come up a little bit closer. Okay, so range of motion, you're going to be looking at all the major joints, not like little tiny fingers, but like shoulders, elbows, wrists, knees, ankles. So first you're going to have them see if they have full range of motion of their shoulders. So that would just be like doing arm circles on both sides, making sure that they're able to, lifting up this way. Sometimes you'll have patients who have like a bad shoulder and they're only able to like go up to here and they can't go all the way up. So I'm assessing both sides. Again, we're always doing bilateral. So if you do one side, you have to do the other to compare it. So good, he's got full range of motion in his shoulders. Next is elbows. So just checking the range of motion for elbows. Some patients have, what is it called? It's not technically double joints, it isn't a scientific term, but sometimes they'll be able to bend past straight on their elbows, so documenting that. Next is wrists, so having a full range of motion with their wrists, and he does. And then ankles and knees. So go ahead and bend both of your knees. Bring your knee up as high as you can. Good. He has full range of motion with his knees. And lastly would be ankles. So full range of motion with the ankles. And also something else you can do is you can put your hand on the joint as it's rotating and see if you feel any crepitus, and that's like that crackling sound. I don't know if any of you are able to pop and crack your ankles. Sometimes you can hear it, but you can also sometimes feel it as the patient's rotating their ankles, and you can feel that crackly sensation. So you have that in this one? Go ahead. Yep, I just felt it crack and pop. So that would be crepitus. And so then that's range of motion. So we did posture, gait, range of motion. The only other thing is that you want to document if the patient has active range of motion, which he does, meaning that he's able to do all of it on his own. He's able to have full range of motion without any help. That would be AROM, active range of motion, or if he needs help, so that would be passive range of motion. So maybe he doesn't have the strength to make his arm go all the way around, but if I'm helping him, maybe he can do it because he just lacks the musculature. Sometimes patients are contracted and their muscles are so contracted that they don't have full range of motion even with someone's assisting them. So that would be passive range of motion if he's able to do it with help. And then assisted range of motion is between passive and active. It's like he can do it with a little bit of help. So maybe I just need to help get him going and he's able to do the rest. So that would be assisted range of motion. And that's the musculoskeletal system.